95% of hair loss tends to be kind of an androgenic alopecia, which both in men and women is really hormonally related. In women, what we tend to see is sort of the areas on the top of the head, so sort of this top portion of the scalp, and it tends to be almost kind of what we refer to as a Christmas tree shape orientation, in that you get kind of off of the part line and then thinning kind of outward from there. And so when we do PRP treatments, we're really going to focus primarily on the frontotemporal kind of region to sort of focus on that hairline, which is really important in terms of the facial framing structure, and then work backwards from kind of the front along the part line and sort of mimic again that sort of Christmas tree shape. So ultimately a triangle with kind of the base of it being your frontal hairline. Occasionally, obviously, some more involvement can be experienced at the vertex of the scalp, in which case we'll try to enhance a little bit of that area too. We tend to inject the PRP in the areas that we want to really get our greatest yield of benefit. But we'll also, in a lot of cases, still inject the PPP, which stands for platelet poor plasma, which is sort of the supernatant or the residual that has also been acquired from spinning down the blood. So the point of that is to override a little bit of the sensory stimulation that you're getting from the needle poke. So the same needles, the same nerves that experience pain experience vibration, and so we can kind of override that stimulation. So on the count of 3, we'll do the first poke. 1, 2, 3, pinch. How you doing?
Fine.
And you'll feel the injection as you feel the fluid kind of injected into the scalp. It'll feel sometimes like somebody's pulling your hair. Would you say that's accurate?
It really wasn't that bad.
Okay. Not all areas in the scalp are the same, so some will hurt more than others. About a 4 to 8 times concentration of your normal platelets. And one of the growth factors that we think is involved in terms of promoting health of the scalp skin is one that recruits actually blood vessels, and then it increases then the health of the kind of perifollicular cells by increasing blood supply and therefore enhancing the health of the actual hair follicles. And so the thought is that PRP will help with the density of the hair that you have in terms of the shaft diameter. It will help prevent further miniaturization of some of the hair follicles maybe that are undergoing kind of a transition into more of a dormancy phase, and then help potentially recruit some of the hair follicles that may have been more recently miniaturized or lost.